Mrs. Chen, long time no see. I haven't seen you hiking with us together for a while. Where have you been?
I couldn't join the hiking because I didn't feel too good. In the past 6 months, my knee has been aching when I work for a while. Sometimes I can't even stand up after sitting on the sofa. And look, my knees are swollen. I used to be able to accompany my grandchildren to the park, but now I can't do it anymore. My knees are weak and tender. I don't know what to do.
I used to have symptoms like yours. I couldn't even climb stairs or go out to shopping. I couldn't even dancing in the park. It was hard for me to move around, and I lost a lot of fun in my life. After consideration with my son took me to Taipei Hospital, orthopedic surgery for checkup. Finally, the doctor found that I had severe arthritis in my both knees. That caused the symptoms I have been having for a long time. In the beginning, I just want a conservation treatment by painkillers. However, my life has been really affected, and my mobility become worse.
Oh, I see. That's why I didn't see you join the folk dance at the park for a while.
I had lost a lot of fun in my life. After a few months of the follow check, my symptoms got worse. My knees were painful and swollen. My doctor recommended that I get a total knee replacement surgery, which improved my condition dramatically last year. My joint deformity was correct. Now I can walk without pain and I can travel abroad.
I have all the symptoms you mentioned. I need to go to Taipei Hospital and get a checkup from the orthopedic surgeon. Doctor, my knees are very uncomfortable in the past 6 months. I have no strength when I work. I come to see you to have my knee checked out.
Okay, Ms. Chen. After a detailed examination, I'm sure that your knee joint have a very severe osteoarthritis. It usually means the cartilage of your knee joint are totally worn away, so it must be very uncomfortable. Usually the typical symptoms are pain, swelling, redness, and deformity of the affected limb. In severe cases, it usually makes walking difficulty for the patient.
How do I treat the arthritis in my knee?
For the early stage, the first-line treatment are medication therapy and muscle training exercise. Usually, in the daily activity, you should avoid excessive stress on your knee joint, such as squatting, climbing deep slopes, and carrying heavy objects. Another goal for the first line are we so-called lifestyle modification. You can use a cart for a heavy object instead of carrying by a hand. And when you're climbing up and down the stair, you should use the handrail. If the rehabilitation or the conservative treatment for 3 to 6 months and fail to relieve the pain, and the joint deformity and discomfort are progressed, even you are doing the rehabilitation. In those cases, the total knee arthroplasty surgery is usually recommended.
I also heard my friend that she had total knee replacement. Can you tell me more about this surgery?
The full name of this surgery, we call that total knee replacement, or we can call it total knee arthroplasty. It is a process that we implant in artificial femoral and tibia joint. The surgeon removes the worn cartilage and replace it with the metal and high-density pads between it.
How do I schedule my artificial knee surgery?
First of all, we will arrange a detailed preoperative assessment for the surgical risk and the anesthesia. If you have a chronic disease such as hypertension or diabetes, you have to return to those physicians to assess the medication need adjustment or not. Because poor control of those chronic disease, it may increase the surgical risk and anesthesia. Other way, it will interfere the wound healing as well. If you are a drinker or a smoker, I really strongly suggest you to stop drinking and smoking. And finally, we will discuss the material of the artificial joint based on your age, your activity level, and what do you need. So if the explanation and the examination is all completed, you can be admitted to hospital for the surgery.
What should I do to prepare the surgery?
There are some practices you can do before the surgery. The first one, you can do the thigh muscle exercise and ankle pumping exercise at home. It may strengthen the muscle around the knee joint and facilitate the rehabilitation. And the second thing, you have to learn the correct method how to use a walker or crutches. Because after the surgery, it will have a little period of time you cannot bear your full weight. After you admitted to the hospital, the physical therapist will also told you how to use the crutches and walker correctly as well.
Doctor, how soon can I start moving and work after surgery?
The post-operative wound pain is very typical. We will prescribe appropriate pain medication for you. The rehabilitation program should be started soon after the surgery. The program including first, quadricep exercise, and the second one is ankle pumping exercise and straight leg raises exercise. These rehabilitation programs may facilitate the blood circulation and reduce the joint swelling. The second one, the physical therapist will tell you how to use the continuous passive movement machine. We call that CPM machine. This machine can help the joint to do the passive range of motion. It may prevent the joint from contracture and stiffness. Usually, the machine will start it from 60 to 70 degrees, and we will increase from 5 to 10 degrees daily. Finally, the degree will reach the maximum 120 degrees. At that moment, if your knee joint is slowly recovered and the pain is getting better, you can be discharged from our ward.
Doctor, how many days do I need to be hospitalization?
In most cases, you can be discharged about 3 to 5 days after the surgery.
What should I pay attention after return home?
After returning home, you should keep your knee rehabilitation at home. Because the knee joint is temporarily cannot bear your weight, so you still need a crutches or walker at home for about 1 month. Once your knee joint is getting better and the function level is improved, you can slowly get rid of the crutches or walker. However, you should avoid overexerting yourself. After this activity, you need appropriate amount of rest for your affected limb. Finally, do your best to maintain your ideal body weight to lower the burden of your knee joint.
Thank you, doctor. I will discuss this with my family and schedule the surgery.
No problem. If you follow doctor's instruction, I think your daily inconvenience, joint deformity, and pain will get improved. I'm looking forward to restore your life of quality and get back on your feet.
Thank you, doctor.